Welcome back to the program. What is the very first feature you notice about another person's face? Often it will be their smile. Whether you like it or not, your smile can say a lot about you.
Well, in the first place, it's a good thing if they're smiling. If they're not smiling so much, then...
There's a bad sign.
Yeah, okay. Well, for this reason, many people try to make their smiles the best they can be, which is why teeth whitening is such big business today.
That's right. So in this morning's Say Our series, we find out more about the procedure available through cosmetic dentistry. Take a look. Everyone loves a bright white smile. And there are many products and services available out there to help you improve your look. Many people are satisfied with the sparkle they get from brushing their teeth twice daily or going for regular cleanings at their dentist's office. But if you decide you wish to go beyond this option to make your smile look brighter, you should study your options. Teeth whitening may or may not be your solution. But first, let's clear up the common misconceptions that most people have before we decide whether teeth whitening is something you want to do.
I think if we look at the most common misconception, the first one that comes to my mind is that teeth whitening is suitable for everyone. The question here is, what kind of stain is it? If it stains from external situation like coffee, tea, red wine and things like that, I think teeth whitening is actually very, very suitable. The second misconception a lot of people would have, and they asked us this very commonly, is that, will that weaken my teeth? Will it be harmful on my teeth? I think first of all, we can understand that by now, teeth whitening procedures have refined itself to a point that we would safely say that in a dental office, there is very little chance that it will weaken or damage a teeth if done properly. Third misconception is that different teeth whitening system gives you different results. What I can say is that if the various factors are taken into consideration, like the amount of time needed, the percentage of peroxide that is used, and the compliance of the patient and so on, and I think the end result should be the same for every kind of teeth whitening product that is based on peroxide out there.
So that means whichever method you choose to whiten your teeth, you should see satisfactory results. It's really a case of convenience and choice. Many people appreciate doing it at home for its flexibility and lower cost, but having it done by a professional means you can just sit back and relax and let the experts do the work for you. This option also saves you time and helps you achieve immediate results. Take note though, over-the-counter products do not include whitening toothpaste or whitening strips. We're referring specifically to home kits using trays. Now, their formulas are much more concentrated, and if used continuously over a period of time, dentists say they can be just as effective as those performed by professionals. Two of the big names used in the industry today are Bright Smile and Zoom. Both bleach the enamel with a whitening gel. What differentiates the two is just the gel components, which differ slightly.
When a patient comes in for teeth whitening, we have to do a thorough examination to make sure that the gums are healthy, record the level of gum recession, and make sure that there are no cavities. When we are happy that the gums and the teeth are healthy, we can proceed with the whitening. During teeth whitening, we have to first apply a protective layer over the gums. Then we apply the gel, which is activated by the light. What the light does is it breaks down the active ingredient in this gel and it oxidizes the stain on the teeth.
There are many products out there that claim to whiten your teeth by 8 to 9 shades lighter instantly. But don't be fooled. You probably need to repeat the treatment several times if you want to see such dramatic results. Otherwise, it's unrealistic to expect bright white teeth overnight.
A realistic target would be about 2 to 3 shades lighter. I know it doesn't sound very dramatic, but in the mouth, it will make a big difference to the patient's smile, and they will get a much brighter smile.
Are all types of stain the same? Are they all easily removable?
Stains come in a spectrum of color from yellow, brown to gray. The yellow stains are normally associated with aging, and those are easy to reverse. The other end of the spectrum, the grayish stains, tend to be associated with medication such as tetracycline that was commonly used in the 70s and 80s and given to kids when they're young. Those stains are very resilient to whitening.
So what do you do if you have the gray stains?
Well, if you have gray stain, it is not realistic to expect an ideal result with just 2 weeks of whitening. You may have to whiten for 3 or even 6 months, okay? And then the results may still not be ideal, and you may have to consider options like veneers.
But you mentioned 3 to 6 months. Is that advisable? Because I would think your teeth and gums would become very sensitive.
Of course, there's some degree of sensitivity, but there are ways to counter the sensitivity. You have to check with your dentist.
What are the other factors that will influence the color of your teeth?
To understand the color of teeth, you have to understand the anatomy of teeth. Let me show you a diagram depicting the cross-sectional view of a tooth. Okay, here is the dentine, and dentine is what gives the yellow color of the teeth. The enamel acts like a frosted piece of glass, modulating the color of dentine, making the teeth look whiter. Some of our patients in their zest to get white teeth have been known to brush their teeth aggressively. By doing that, they do not realize that they are making the color of teeth more yellow because they are thinning out this layer of enamel.
So when your enamel is thinned out, can you have it back again? Can it grow thicker?
No. Enamel is a substance that is finite in your body. What you are born with, that's it. It does not regenerate.
Whether or not you seek professional help, do remember that daily dental habits are still key to maintaining that beautiful white smile. Avoiding overexposure to products that stain your teeth and brushing soon after meals will help keep your teeth white. And then, all that's left for you to do is open your mouth and show what a beautiful smile you've got. Okay, that's $1 million smile for you. Well, next week on Say I will talk more about different teeth implant procedures.
Okay, because it is interesting about the whole whitening procedure. I think many of us have questions about that. And you know what, if you have more questions and other things you'd like to find out, you can also make a visit to our website for more information on the topics discussed. It's channelnewsasia.com/ptm/sayr. Some of the frequently asked questions are ready for you online, so you can go there, browse through, and also you can meet our panel of experts who are ready to answer any questions you might have. You can simply write into us. Send us an email, ptm@channelnewsasia.com.
And a few of you already wrote in asking about many questions, some on teeth grinding and also some about the gaps between your teeth. Well, we have good news. Our dentists have already come back to us with the answers, and we have uploaded them on our website. Just go to our website to see what they have to say. And if you have any questions, remember again, you can always email us at ptm@channelnewsasia.com, and we'll try to get your answers.
Of course, it's all bite-sized information there. Just...
Okay, we'll be going for a quick break now. We'll be right back with more.
That's how I entertain myself, you know.